Welcome to session 2, the evidence for a healthy campus and a whole campus approach. My name is Mahon and I'm the National Healthy Campus Coordinator at the Higher Education Authority, and myself and my colleague
Kristen Venianakis, an Executive Officer in the Healthy Campus team here at the Higher Education Authority,
will guide you through this session. We hope that after lesson 1 you have a greater sense of what Healthy Campus is about, why it's important, and that you are still committed to the movement. For some context, the HEA has a statutory responsibility at central government level for the effective governance and regulation of higher education institutions and the higher education system. Since 2022, the HEA has been responsible for the progression of the Healthy Campus Charter and Framework across our institutions in partnership with Healthy Ireland through the Department of Health. The HEA is also responsible for the National Student Mental Health and Suicide Prevention Framework and other policy areas that relate to our most holistic sense of well-being, like the work on ending sexual violence, equality, access, and more. So in today's session, we're going to start with looking at the evidence around student and staff health and well-being. Then we're going to look at the evidence around health promoting universities. We're going to take mental health and the evidence around that in terms of a whole campus approach as an example. And we're going to provide you with an introduction and overview of the Healthy Campus Self-Evaluation Toolkit. The course learning outcomes covered in this session are: number 1, know why being a health promoting campus matters, and number 2, understanding the Okanagan Charter. In terms of the evidence, I think it's important to highlight some research around student and staff health and wellbeing, of which there's loads, so we're really only skimming the surface. But I think what you'll find is it's particularly important to have that evidence when we're making a business case for Healthy Campus, and when we're talking to those who don't see this as part of core business. It's really, really important to remind people at an individual level the change and the impact that this can make to individuals and kind of our campus communities. So we know that education and health are inextricably linked. Young people who transition and attend to university undergo a major life transition, which can include moving away from home, a change in peer supports, new environments, and a new way of learning. By its very nature, it can be a stressful time. And it's meant to be a stressful time. That's part of the transition of life. And we know that behaviours that students acquire are reinforced while in college and university may shape their future health and the health of future generations. Aside from this change, adolescence and young adulthood is the peak time for the onset of mental health difficulties. And more importantly, we know that 75% of mental health difficulties that persist in adulthood have emerged before the age of 25. Now, this is important because 20 is the approximate average age of the undergraduate community. And while we recognise that there are other players in our community in terms of students, like postgraduate students, mature students, and others who access through various means, it's important to kind of keep that in mind, especially when it comes to mental health. Student success and well-being are inextricably linked. Optimal psychological development, which requires good mental health, can lead students to successfully engaging in their learning. In a review article based on studies among students in Australia, the authors reported that loneliness, also commonly linked to depression, was an independent risk factor for low study progress. In one study found that students who reported good self-rated health were more committed to college. And the most prominent predictors of student commitment included the feeling of being enrolled in the right course, academic self-efficacy, perceptions of the academic environment, depression scores, physical activity, and self-rated health. Depression emerged as the most significant predictor of student, general, and institutional commitment. So when we're thinking about student and staff health and wellbeing, I think now is a good time to maybe draw your attention to the Okanagan Charter, and specifically Call to Action 2, which asks institutions to lead health promotion, action and collaboration locally and globally. So it asks that we integrate health, wellbeing and sustainability in multiple disciplines to develop change agents. I love the word change agents. I've robbed it and I use it all the time. So it asks that we use cross-cutting approaches to embed an understanding and commitment to health, wellbeing and sustainability across all disciplines and curricular, thus ensuring the development of future citizens with the capacity to act as agents for health promoting change beyond our campuses. And I think this really highlights the opportunity that we have.
In the whole campus systems approach, we must broaden the conversation to include the whole campus community, our students, staff, and broader community around which an institution is connected. Staff wellbeing is important in its context of workplace wellbeing, and we can see on the screen the many benefits to addressing wellbeing in the workplace. Some of these include increased physical and mental wellbeing, increased performance and productivity, increased employee engagement, decreased absenteeism and sick leave.
Student and staff relationships are also really important when we consider the interrelations between the parts of the system or the setting. So I guess when you have your systems hat on, you understand that these things are interacting, and a part of student well-being is staff, and so therefore staff well-being will directly impact students. Now, there is a tendency to separate these in terms of well-being in a sort of operational sense, but it's really, really important that we kind of hone in the message that these things are interconnected. And so at an operational level, when it comes to an institution and the complexity of running it, we can really struggle sometimes to bridge that gap. And I guess that's where the Healthy Campus Framework comes in. And I guess when we think about student success and engagement and all these really important pieces of work, these are directly impacted by staff and the interrelations. The health promoting settings approach is well established in health promotion, with organisational settings being understood as complex systems able to support human well-being and flourishing. However, despite the reach and evident importance of higher education as a sector, healthy universities overall has not received high-level international leadership comparable to many other setting programmes. While research is still limited, there is a growing evidence base drawn from the education sector to suggest that complex, comprehensive, multi-component, whole system approaches are more likely to result in positive outcomes for students, staff, and the organisations as a whole.
As mentioned, a lot of the evidence in relation to Healthy Campus is supported by research on schools. Schools, like universities, are complex systems influenced by multiple factors. A review of evidence relating to schools support a whole school approach, suggesting that effective programs are likely to be complex, multifactorial, and involve activity from more than one domain. The whole school approach advocated within health promoting schools moves beyond singular or narrow focuses on health education to one that aligns curriculum approaches with efforts to build social and emotional literacy, positive peer-to-peer relationships, and inclusive school communities with the knowledge that these are all reflected in mental health and well-being. The evidence for a whole of setting approach is key to making effective change and creating supportive environments for both our students and staff. A study conducted by Boyd and Laws in 2019 examined system-based and multifaceted approaches to bullying. The analysis explored whether cluster or singular interventions made a difference to reported bullying behaviours in schools. The school-wide actions reported on include collaborative leadership, creating a wellbeing culture, effective policies and procedures, supports for students, and prioritising professional learning and development. Overall, schools that reported much lower rates of bullying behaviours implemented whole school-wide practices. Specifically, effective behaviour management policies and procedures were associated with lower levels of student aggressive behaviours. Effective schools had, amongst other things, strong leadership with strategic plans, preventative programs based on student needs, good referral processes and relationships, and used data to suggest needs and review programs.
Some other pieces of research to point to the same. While it is not possible to state with certainty that multi-component whole settings approaches are more successful in college and university settings than one-off activities, the evidence points in this direction. Effective programs are likely to be complex, multifactorial, and involve activity in more than one domain. Embedding a whole system commitment to health into university structures and processes results in positive outcomes for students, staff, and the organisation as a whole.